It's easy to turn to food after a stressful day, but on this week's edition of Today's Health, experts warn comfort and stress eating can quickly become habit. Nicole Samavia has some tips to make sure this doesn't happen to you.
What do you reach for after a stressful day? Beer? Chips? We all do it. In fact, human nature says we rarely eat based on hunger.
We eat because we're in a social atmosphere, there's music playing.
Registered dietitian nutritionist Bonnie London says even positive feelings lead to emotional eating.
Birthday party, vacation, to, a house remodel, stressful work. So anything can cause people to go off kilter.
Whether you're happy or stressed, comforting your body with unhealthy food will only make you eat more and make your stress worse.
It's only going to exacerbate the situation by increasing inflammation, and we know that these foods also change the microbes in our gut, which we are understanding more and more affect our mental status.
London says getting ahead of the game starts in the morning.
A great balanced breakfast with maybe some high quality protein. I love like a vegetable omelet, just for example. And also something really important is hydration. Being even slightly hydrated can increase these stress hormones.
So keep healthy food on hand and have a plan.
When they get home and they don't have anything prepared and things aren't around, and that's when bad things happen.
Try to get a good night's sleep, take the stress out at the gym, and reach for green food and fish for a mood booster.
Not the mac and cheese.
In other health news this morning, evidence of some popular heartburn drugs may lead to early death. Researchers at Washington University School of Medicine in St. Louis analyzed data on 350,000 people on heartburn medications. Some took proton pump inhibitors, others took H2 blockers. They found a higher death risk among those taking proton pump inhibitors for an extended period of time. Cases of dangerous bacterial infections are increasing in the U.S. C. diff is frequently linked to healthcare systems. It's extremely difficult to treat, especially those that keep recurring in patients. University of Pennsylvania researchers found recurring C. diff infections have increased dramatically each year since 2001. Early research from Boston Children's Hospital could someday lead to a test to determine whether a baby died from sudden infant death syndrome or another cause. Babies who died from SIDS were shown to have higher levels of serotonin. Other studies have also shown serotonin-related abnormalities in SIDS cases. More research is needed, but could indicate an underlying SIDS risk in babies. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.